So good day everyone. We are about to report the factors 2, 5, 7, 10, and 12 deficiency. So what are clotting factors? So clotting factors are protein in the blood that control bleeding. So when a blood vessel is injured, the walls of the blood vessel contract to limit the flow of blood to the damaged area. So then small blood cells called platelets stick together to the site of injury and spread along the surface of the blood vessel to stop the bleeding. So at the same time, chemical signals are released from small sacs inside the platelets that attract other platelets to the area and make them clump together to form what is called a platelet plug. So on the surface of these activated platelets, many different clotting factors work together in a series of complex chemical reaction known as the coagulation cascade to form a fibrin clot. So the clot acts like a mesh to stop the bleeding. So our blood has a natural mechanism to stop the bleeding. So when an injury occurs, this process is called coagulation and involves several proteins, clotting factors. So these factors work together in a sequence known as the coagulation cascade. So each clotting factor plays a specific role in activating the next factor in the chain, eventually leading to the formation of a fibrin clot that seals the wound and stops the bleeding. So if any of the clotting factors are missing or are not working properly, the coagulation cascade is blocked. So when this happens, the blood clot does not form and the bleeding continues longer than it should. So what are rare clotting factors deficiency? So if any of the clotting factors are missing or not working properly, the coagulation cascade is blocked. So when this happens, the blood clots did not form and the bleeding continues longer. So deficiencies of factors 8 and factors 9 are known as hemophilia A and B respectively. So deficiency or defect of von Willebrand factor is known as von Willebrand disease. So rare clotting factors deficiencies are bleeding disorders in which one or more of the clotting factors, like factors 1, 2, 5, 5 combined with 8, 7, 10, 11, 12, or 13 is missing or not working properly. Less is known about these disorders because they are diagnosed so rarely. So all factors deficiencies are rare diseases. So, rare clotting factors deficiencies are considered ultra-rare diseases because they affect even fewer people. So, humans have 23 pairs of chromosomes, 22 pairs of autosomal chromosomes called autosome, and 1 pair of sex chromosomes, X or Y. Unlike hemophilia, which is due to mutations on the X chromosome, rare clotting factors deficiencies are due to mutations on the autosomes. So imagine your body is like a construction site. So when you get injured, it is like a minor accident to that site. To fix that damage and further prevent further problems, the body needs to form a solid barrier like a wall around the injured area. So this wall is made of a special protein called fibrin, which is formed through a complex chain reaction involving many different workers known as clotting factors. So one of these crucial workers is factor 2, also called prothrombin. It's like the foreman who oversees the construction of the wall. So if you have factor 2 deficiency, it's like the foreman is missing or not working properly. So as a result, the construction of the wall is incomplete, leaving the injured area vulnerable and prone to excessive bleeding. So next is the factor 2 or prothrombin deficiency. So factor 2 or prothrombin deficiency is an inherited bleeding disorder that is caused by a problem with factor 2. So because of the body produces less prothrombin than it should, or because the prothrombin is not working properly, the clotting reaction is blocked prematurely and the blood clot does not form. So factor 2 deficiency is an autosomal recessive disorder, which means both parents must carry the defective genes to pass it on their child. So it means that the disorder affects both males and females. Factors 2 deficiency is very rare. So it can also be acquired later in life as a result of liver disease, vitamin K deficiency, or certain medications such as blood thinning drug or warfarin. So acquired factor 2 deficiency is more common than the inherited form. So for the epidemiology, the incidence is estimated at 1 in 2 million in the general population. So factor 2 deficiency is inherited in an autosomal recessive fashion, meaning that both parents must carry the gene to pass it to their children. It affects men and women equally. So this rare condition affects approximately 1 in 2 million people globally, meaning it's uncommon as finding a four-leaf clover in bustling marketplace. So the cause of this deficiency lies in our genes. So for factor 2 deficiency to occur, both parents must carry a specific genetic variant. So it's like inheriting two keys that unlock the door to the deficiency, but neither parents alone can open it. This pattern of inheritance is called autosomal recessive, meaning the condition affects both men and women equally. So think of genes as instruction for building proteins. So when both parents pass on the altered instruction, the child's body doesn't produce enough functional prothrombin. So this translates to a city with roads that are constantly under repair, vulnerable to even the slightest scratch. Individuals with factor 2 deficiency may experience prolonged bleeding after injuries, surgery, or even minor cuts. So for the pathophysiology, so imagine a cut on your finger. So in a healthy body, a cascade of events unfolds to stop the bleeding, forming a strong clot that seals the wound. But for individuals with factors 2 deficiency, this intricate process is disrupted, like a missing piece in a complex puzzle. So let us embark on a journey to understand this intricate world of blood clotting. So in a blood clotting cascade, a series are carefully orchestrated steps that transform liquid blood into a solid clot. So this intricate involves a multitude of proteins called clotting factors that work together in a precise sequence. So factor 2, also known as prothrombin, plays a crucial role in this symphony of blood. So when an injury occurs, the damaged tissue triggers the cascade, activating the first factor. So this sets off a chain reaction, with each activated factor triggering the next in line. So prothrombin stands at a pivotal point in this chain. So imagine a keyhole waiting for it perfect to fit. So another activated factor insert itself into a keyhole, unlocking the prothrombin potential. So once this prothrombin undergoes a dramatic transformation, shatter its outer layer to become thrombin. So this potent enzyme acts like a master builder, wielding its power to convert fibrinogen, a soluble protein, into a fibrin, the insoluble building block of a clot. So fibrin strands weave themselves together, forming a sturdy mesh that traps blood cells and effectively plugs the leak. So for the symptoms, people with factor 2 deficiency may experience bleeding such as nosebleeds or epistaxis, easy bruising, heavy or prolonged menstrual bleeding or menorrhagia, bleeding into joints, hemarthrosis, muscle bleeds, bleeding in the mouth, particularly after dental surgery or tooth extraction, bleeding in the gut or gastrointestinal hemorrhage, bleeding from the umbilical cords, stump at birth, abnormal bleeding during or after injury, surgery, or childbirth. So bleeding in the central nervous system, the brain and spinal cord, and lastly, blood in urine or hematuria. So for the diagnosis, factor 2 deficiency is diagnosed by a variety of blood tests. So the doctor will need a test for prothrombin time, or PT, and activated partial prothromboplastine, or APPT. So if both tests have prolonged time, then they will need to measure the blood level of factors 1 to 5, 7, 9, and 10. So diagnostic tests should be performed by a specialist at a hemophilia bleeding disorder treatment center. So for the pharmacological treatment of factor 2, so bleeding can be controlled by the intravenous infusion of plasma or concentrates of clotting factors. So if you lack vitamin K, you can take this vitamin by mouth, through injection under the skin, or through a vein intravenously. So infusion of plasma or clotting factors concentrates. So this method involves directly supplementing the missing prothrombin. So in plasma, this option involves infusing fresh frozen plasma, which contains various clotting factors including prothrombin. So fresh frozen plasma is readily available and can be used for both acute and chronic bleeding episodes. So for clotting factors concentrates, so these are more concentrated forms of prothrombin specifically designed for treating factor 2 deficiency. So they are available in different types, so each with its own advantages and disadvantages. So some options include prothrombin complex concentrates. So these concentrates contain a combination of prothrombin and other clotting factors like 7, 9, and 10. So they are effective in controlling bleeding but carry a higher risk of blood clots. And next is recombinant prothrombin. So this is newer form of prothrombin produced through genetic engineering, so it offers the advantage of being free from potential viral contamination associated with plasma-derived products. So in addition to replacing factor 2, another treatment option involves antifibrinolytics. So these medication work by preventing the breakdown of blood clots, further promoting hemostasis. So antifibrinolytics are often used in conjunction with factor replacement therapy for more severe bleeding episodes or in situations where clotting is particularly difficult to achieve. So for the non-pharmacological treatment to control bleeding is achieved using prothrombin complex concentrates, like what I've said, or fresh frozen plasma. So prothrombin complex concentrates differ in the amount of Fi. Factors 2, they contain depending on the manufacturer, so which complicates treatment because prothrombin complex concentrates can increase the risk of blood clots. So they are typically only prescribed for surgery or after trauma. So for the prevention of the factor 2 deficiency is to avoid activities that increase the risk of bleeding. Next is maintain a healthy lifestyle, including a balanced diet and regular exercise. Lastly is the genetic counseling. So next factor is the factor 5 deficiency or Oran's disease or parahemophilia. Factors 5 deficiency is an inherited bleeding disorder that is caused by a problem with factor 5 because the body produces less factor 5 than it should, or because the factor 5 is not working properly. The clotting reaction is blocked prematurely and the blood clot does not form. Factor 5 deficiency is an autosomal recessive disorder, which means that both parents must carry the defective gene to pass it to their child. So it means that the disorder affects both males and females. So factor 5 deficiency is very rare. So for the epidemiology, factor 5 deficiency, also known as Oran's disease or parahemophilia, is a rare blood clotting disorder affecting roughly 1 in 1 million people worldwide. So despite its global occurrence, cases are unevenly distributed, with the highest incidence observed in populations with more frequent consanguineous marriage, such as those found in the Middle East, Mediterranean, and South Asia. In the contrast, the condition is extremely rare in Caucasians and virtually non-existent in Africans and Asians. So the disease is caused by genetic mutation in the factor 5 gene, which inherits in an autosomal recessive manner. So this means that both parents need to carry the mutated genes for their child to develop the disorder. While it can manifest at any age, most cases are diagnosed within the first few decades of life, so both genders are equally affected, with no significant difference in prevalence observed. So for the pathophysiology, so here, the factor 5 circulates in an inactive form. During coagulation, factor 5 is converted to the active cofactor, factor 5A, via limited proteolysis by the serine protease A thrombin. Factor 5A and activated factor 10A form the prothrombinase complex. So imagine blood clotting like a complex puzzle, which each piece plays a crucial role in forming a strong clot. So factor 5 is one such piece. But in people with factor 5 deficiency, this piece is missing or defective. So normally, an active factor, factor 5 circulates in our blood in an inactive form and waiting for its cue to act. So this is like having the puzzle piece in your hand but not yet placing it on the board. So activation, when injury occurs, a cascade of events is triggered, leading to the activation of factor 5. This activation is like having instructions on where to place the puzzle piece. So a special protein called thrombin acts like a helper, cutting factor 5 and transforming it into its inactive form, which is factor A. Prothrombinase complex. Now that factor 5A is ready, it teams up with another activated protein, which is factor XA. Together, they form a powerful duo called the prothrombinase complex. So this complex is like the final assembly step where the puzzle pieces come together and form the clot. So in factor 5 deficiency, so this missing piece of people with this condition lack the necessary factor 5 or have a version that doesn't work properly. So this is like having a missing puzzle piece or one that doesn't fit correctly. So in the incomplete puzzles without sufficient factor 5A, the prothrombinase complex cannot form correctly, leading to impaired blood clot formation. So this is like not having enough pieces to complete that puzzle. So this results in a weak and incomplete structure. So for the symptoms, people with factor 5 deficiency may experience bleeding such as nosebleeds, easy bruising, heavy or prolonged menstrual bleeding, bleeding in the mouth, particularly after dental surgery or tooth extraction, bleeding in the gut, muscle bleeds, abnormal bleeding during or after injury, surgery, or childbirth, bleeding into joints, bleeding in the central nervous system. So for the diagnosis, factor 5 deficiency is diagnosed by a variety of blood tests that should be performed by a specialist at the hemophilia bleeding disorder treatment center. So the doctor will need to test the prothrombin time and activated partial thromboplastin. So if both tests have prolonged time, then they will need to measure the blood level of factors 1, 2, 5, 7, 9, and 10. So people with abnormal level of factor 5 should also have their factor 8 level checked to rule out combined factor 5 and factor 8 deficiency, which is completely separate. So pharmacological treatment. So Coumadin can be used to impair the clotting system. So this will stop the growth of the clot and reduce the risk of the future clot. Next is the tranexamic acid, which is given to be temporarily boost the proteins that stabilize blood clot. So in the non-pharmacological treatment, so factor 5 deficiency is diagnosed by a variety of blood tests, like by the specialist. So they will need that prothrombin time and activated partial thromboplastin And people have abnormal level of factors 5 should also have their factor 10 check. So for the prevention, avoidance of medication that increase risk bleeding, regular checkups with a hematologist, lifestyle modification, treatment of bleeding episodes, and genetic counseling. Next factor is factor 7 deficiency or Alexander's disease. So, factor 7, a rare inherited disorder characterized by a lack of the coagulation protein factor 7, leading to problems with blood clotting. So, the severity of symptoms vary greatly, ranging from asymptomatic individuals to those experiencing life-threatening bleeds. So, for the epidemiology, factor 7 deficiency is a rare blood clotting disorder caused by a lack of a protein called factor 7. So, which is crucial to blood clot formation. So, that factor 7 is also known as proconvertin. Yeah, while it affects roughly 1 in 300,000 to 500,000 people worldwide, its prevalence appears higher in certain regions like Mediterranean and Middle Eastern countries, as well as among Ashkenazi Jews. The severity of the conditions varies greatly, with some individuals experiencing frequent bleeding episodes due to extremely low factor 7 levels, while others may have no symptoms at all and slightly lowered levels. Next is the pathophysiology. So factor 7 deficiency is also known as proconvertin, plays a crucial role in initiating the extrinsic pathways of the coagulation cascade. So when blood vessel injury occurs, tissue factors is exposed to factor 7, so which then activates factor X. This activation triggers a series of downstream reaction, ultimately leading to the formation of a fibrin clot and stop the bleeding. So, in individuals with factor 7 deficiency, mutations in the factor 7 gene lead to decreased production or dysfunctional factor 7 protein. So, this results in deficiency of factor 7 in the blood, causing a delay or impairment of the extrinsic pathway and ultimately insufficient clot formation. So, the severity of bleeding symptoms in factor 7 deficiency depends on the degree of factor 7 deficiency. So individuals with mild deficiency may experience only minor bleeding episodes such as easy bruising, nosebleed, or heavy menstrual period. So in contrast, those with severe deficiency can have life-threatening bleeds, including intracranial hemorrhage, gastrointestinal bleeding, and joint bleeds. So the presence of these other factors further complicates the clinical picture. So for example, the environmental factors like vitamin K deficiency, liver disease, or medication can worsen the bleeding tendency. Additionally, some individuals with factor 7 deficiency may have a hypercoagulable state, paradoxically increasing the risk of thrombosis. So for the symptoms of people with factor 7 deficiency may experience bleeding such as nosebleeds, easy bruising, heavy or prolonged menstrual bleeding, bleeding in the mouth, particularly after dental surgery or tooth extraction, bleeding in the heads for newborns, heavy bleeding at circumcision, bleeding in the gut or gastrointestinal bleeding, and bleeding into joints or hemarthrosis. So for the diagnosis is made through activated partial thromboplastin time test and prothrombin time test. So diagnosis can be confirmed with factor 7 assay. Acquired factor 7 deficiency can occur in patients with liver disease and vitamin K deficiency and those taking oral anticoagulants. So for the pharmacological treatment, the prothrombin complex concentrates. So these are blood products that contain several clotting factors, including factor 7. So prothrombin complex concentrates can be used to treat bleeding episodes, but they are not as effective as factor 7A and may carry a higher risk of blood clots. Next is the fresh frozen plasma. So this is a blood plasma that has been frozen within hours of donation. So fresh frozen plasma contains all the clotting factors including factor 7. However, this FFP is less concentrated than PCCS or prothrombin complex concentrates, and factor 7 and it carries a higher risk of viral infection. Next is the antifibrinolytic drugs. So these drugs such as epsilon, aminocaproic acid, and tranexamic acid help to prevent blood clots from dissolving. So they may be used in combination with other treatments to control bleeding in people with factor 7 deficiency. Next is desmopressin. This medication can be used to treat mild bleeding episodes in some people with factor 7 deficiency. So it works by increasing the release of factor 8 from the body's stores. Next, for the non-pharmacological treatment, first is the prophylactic therapy. Some individuals with factor 7 deficiency may benefit from preventative or prophylactic therapy to minimize future bleeding complications. So this usually involves regular infusions of factor 7 concentrates or recombinant factor 7 to maintain a certain level of the clotting factor in the blood. Next is genetic counseling. So if you have factor 7 deficiency, you may want to consider genetic counseling to learn more about the risk of passing the conditions onto your children. So next, for the prevention is to avoiding triggers. So certain activities and medication can increase the risk of bleeding for people with factor 7 deficiency. So these triggers may include contact sports or other activities that may involve a high risk of injury. Next is alcohol and tobacco use. Prompt treatment of bleeding episodes. So early intervention is crucial to control bleeding and further prevent complications. So people with factor 7 deficiency should be familiar with the signs and symptoms of bleeding and have access to factor 7 replacement therapy at all times.
So next, the factor 10 deficiency. Factor 10 deficiency is an inherited bleeding disorder that is caused by a problem with factor 10. Because the body produces less factor 10 than it should, or because the factor 10 is not working properly, the clotting reaction is blocked prematurely and the blood clot does not form. Factor 10 deficiency is an autosomal recessive disorder, which means that both parents must carry the defective genes to pass it on to their child. It also means that the disorder affects both males and females. Factor 10 deficiency is one of the rarest inherited clotting disorders. So for the pathophysiology of factor 10 deficiency, factor 10 deficiency, a rare bleeding disorder, disrupts the blood clotting process. Without enough of factor 10, blood vessels struggle to form stable clots, leading to prolonged bleeding. This deficiency affects the collaboration between blood cells and platelets, hindering the body's ability to efficiently seal wounds. So for the pathophysiology of factor 10 deficiency, factor 10 deficiency, a rare bleeding disorder, disrupts the blood clotting process. Without enough of factor 10, blood vessels struggle to form stable clots, leading to prolonged bleeding. This deficiency affects the collaboration between blood cells and platelets, hindering the body's ability to efficiently seal wounds. So for the symptoms of factor 10 deficiency, people with factor 10 deficiency may experience bleeding such as nosebleeds or epistaxis, easy bruising, bleeding in the gut or gastrointestinal hemorrhage, bleeding into joints or hemarthrosis, muscle bleeds, bleeding from the umbilical cord stump at birth, bleeding from the mouth, particularly after dental surgery or tooth extraction, bleeding during or after surgery or injury, heavy or prolonged menstrual bleeding or menorrhagia, bleeding after circumcision, abnormal or prolonged bleeding after childbirth, first-time miscarriage or spontaneous abortion, blood in urine or hematuria, and lastly, bleeding in the central nervous system, the brain, and the spinal cord. So for the non-pharmacological treatment for factor 10, we have also three: physical therapy, education and support, and blood transfusion. So for physical therapy, physical therapy plays a crucial role in managing factor 10 deficiency by focusing on joint protection and strengthening exercises. This non-pharmacological approach aims to enhance joint stability, reduce the risk of bleeding-related joint damage, and improve overall functional abilities in affected individuals. And for the educational and support, education is a vital empowering individuals with factor 10 deficiency to understand their condition, recognize bleeding symptoms, and adhere to preventive measures. Support groups provide emotional and informational support, fostering a sense of community among patients and caregivers, helping them navigate the challenges associated with factor 10 deficiency. And lastly, blood transfusion. In cases of severe bleeding or surgery, blood transfusion may be necessary to replace the deficient clotting factors rapidly. While not strictly non-pharmacological, it is a crucial intervention involving the infusion of donor blood or clotting factor concentrates to address acute bleeding episodes in factor 10 deficiency. So for the pharmacological treatment, we have three pharmacological treatment, which is the vitamin K supplementation, prothrombin complex concentrate, and anti-hemophilic factor. So for the vitamin K supplementation, vitamin K is essential for the synthesis of clotting factors in the liver. And supplementation with vitamin K helps correct deficiencies, promoting the production of clotting factors, and is commonly used to reverse the effects of oral anticoagulants like warfarin. And for the prothrombin complex concentrate, for example, the Octaplex and Kcentra, these concentrates contains a combination of clotting factors, including factors 2, 7, 9, and 10. So they are used to rapidly reverse the effect of anticoagulation, particularly in cases of severe bleeding or urgent surgery. And lastly, the anti-hemophilic factor such as alphanate. This is the clotting factor replaced therapy used in hemophilia A, where there is deficiency of factor 10. By providing exogenous factor 10, it helps restore the clotting cascade, preventing and treating bleeding episodes in patients with hemophilia A. So for the non-pharmacological treatment for factor 10, we have also three: physical therapy, education and support, and blood transfusion. So for physical therapy, physical therapy plays a crucial role in managing factor 10 deficiency by focusing on joint protection and strengthening exercises. This non-pharmacological approach aims to enhance joint stability, reduce the risk of bleeding-related joint damage, and improve overall functional abilities in affected individuals. And for the educational and support, education is a vital empowering individuals with factor 10 deficiency to understand their condition, recognize bleeding symptoms, and adhere to preventive measures. Support groups provide emotional and informational support, fostering a sense of community among patients and caregivers, helping them navigate the challenges associated with factor 10 deficiency. And lastly, blood transfusion. In cases of severe bleeding or surgery, blood transfusion may be necessary to replace the deficient clotting factors rapidly. While not strictly non-pharmacological, it is a crucial intervention involving the infusion of donor blood or clotting factor concentrates to address acute bleeding episodes in factor 10 deficiency. So to prevent this factor 10 deficiency, we have 3: regular replacement therapy, avoidance of trauma, and regular monitoring and medical supervision. So for regular replacement therapy, prevention in factor 10 deficiency often involves regular replacement therapy with clotting factor concentrates to maintain adequate levels of factor 10, reducing the risk of spontaneous bleeding and minimizing the impact of trauma-induced bleeding events. And for the avoidance of trauma, given the increased bleeding tendency in factor 10 deficiency, individuals are advised to avoid activities that may lead to trauma or injury, as well as to take precautions to minimize the risk of accidents. This proactive approach aims to prevent bleeding episodes and their associated complications by minimizing exposure to potential sources of injury. And lastly, the regular monitoring and medical supervision. Regular monitoring of factor 10 levels and overall health, coupled with ongoing medical supervision, is essential for identifying and addressing potential issues promptly. So this proactive management allows healthcare providers to adjust treatment plans, offer guidance on lifestyle modifications, and intervene early to prevent complications associated with factor 10 deficiency. So next, factor 12 deficiency. Factor 12 deficiency is an inherited bleeding disorder that is caused by a problem with factor 12. Because the body produces less factor 12 than it should, or because the factor 12 is not working properly, the clotting reaction is blocked prematurely and the blood clot does not form. Factor 12 deficiency is an autosomal recessive disorder, which means that both parents must carry the defective genes to pass it on to their child. It also means that the disorder affects both males and females. Factor 12 deficiency is very rare. So for the epidemiology, its incidence is estimated 1 in a million. Factor 12 deficiency is inherited in an autosomal recessive fashion, meaning both parents must carry the gene to pass it on to their child. It affects men and women equally. It is more common in Asians than other ethnic groups. So for the pathophysiology of factor 12 deficiency, it is a rare bleeding disorder occurs when there is a shortage of factor 12, a clotting protein in the blood. This deficiency can lead to prolonged bleeding after injury or surgery. Example, blood test can reveal lower than normal levels of factor 12, helping diagnose and manage this uncommon condition. So for the symptoms of factor 12 deficiency, most people with factor 12 deficiency do not experience many symptoms, even after major surgery. However, some experience is poor wound healing. So to diagnose factor 12 deficiency is often diagnosed accidentally during a routine coagulation blood test done prior to surgery or due to family history. Diagnosis is made by prothrombin time or PT and activated partial thromboplastin or APTT test, followed by a factor 12 assay to confirm the diagnosis. So the pharmacological treatment for factor 12 deficiency is we have two antifibrinolytic agents, for example, the tranexamic acid and the prothrombin complex concentrate, and for example, the Kcentra. Tranexamic acid helps prevent excessive bleeding by blocking the breakdown of blood clots by inhibiting the action of a protein involved in clot dissolution. It promotes clot stability reducing the risk of bleeding in individuals with factor 12 deficiency. And the prothrombin complex concentrate, Kcentra contains concentrated forms of clotting factors, including factor 12. It's used to quickly restore clotting ability in situations where there's a significant bleeding or before surgical procedures, providing the necessary factors to support effective blood clot formation. So the pharmacological treatment for factor 12 deficiency is we have two antifibrinolytic agents. For example, the tranexamic acid and the prothrombin complex concentrate, and for example, the Kcentra. Tranexamic acid helps prevent excessive bleeding by blocking the breakdown of blood clots by inhibiting the action of a protein involved in clot dissolution. It promotes clot stability, reducing the risk of bleeding in individuals with factor 12 deficiency. And the prothrombin complex concentrate, Kcentra contains concentrated forms of clotting factors, including factor 12. It's used to quickly restore clotting ability in situations where there's a significant bleeding or before surgical procedures, providing the necessary factors to support effective blood clot formation. So to prevent this factor 12 deficiency, we have three: regular medical monitoring, avoidance of blood thinning medications, and preventive measure for trauma. So for the regular medical monitoring involves routine checkups and laboratory tests to assess factor 12 levels and overall health. This proactive approach allows providers to identify any changes or potential issues early, and any interventions to prevent bleeding complications in individuals with factor deficiency. And for the avoidance of blood thinning, individuals with factor 12 deficiency are advised to avoid medications that can thin the blood, such as anticoagulants. This precautionary measure and helps maintain in the blood clotting process and reduces risk rather of excessive bleeding. And for the preventives for trauma, taking precautions to avoid trauma is crucial in managing deficiency. These include adopting safety measures to minimize the of injuries and accidents, which could trigger bleeding by being mindful or activities that pose a threat. Individual can reduce the likelihood of trauma-induced bleeding in the presence of factor 12 deficiency. So that's the end of our discussion for factors 2, 5, 7, 10, and 12 deficiencies. So thank you for listening.